Hi there, and welcome to The Public's Health, the show that puts you, the public, back into public health. I'm Dr. Tony Iton, your host. Today we're going to be talking about a subject that is probably of great concern to you. It's certainly gotten a lot of media attention. Avian influenza, or bird flu, has killed people in various countries around the world, and it has certainly infected a lot of birds, some of which are migratory birds, and the expectation is that eventually it'll come to the United States. We're going to be talking about this subject from a slightly different perspective. You have a daily routine, the things that you need to do to continue your daily lives. You need to go to work. You need to get food. You need to use transportation. Your children need to go to school. And finally, many of us need to get health care. We're going to be talking about this subject from those perspectives. How do you maintain your daily routine? During a circulating pandemic, when the virus is in our community, we're going to have concerns about coming into contact with strangers, people at the grocery store, people at the pharmacy, at the post office, at a variety of different places where we might feel that we could be exposed to the virus. This show is going to talk to you about some simple precautions that you can take and give you a little bit of knowledge about how you can avoid becoming infected by just practicing simple respiratory hygiene, hand washing, the kinds of things that your grandmother always taught you. We're going to talk to some experts, and we're going to see some different settings in which precautions are being taken and planning is being done to try to minimize the risk of exposure in these settings. We all need to do these things. We need life to go on during a pandemic. We hope that this information will help you, help us, keep as many people healthy and safe throughout this pandemic. Thank you. Many of us have to work to maintain our normal daily routines. Some of us work for ourselves, some work for small businesses, some work for large businesses. During a pandemic, you may be asking, is my work going to be there? How will I get to work? What kind of preparations are being made by my employer to ensure that things go on as routine during a pandemic? We're joined now by an expert in business continuity, Brandon Bond. Welcome, Brandon.
Thank you. Glad to be here.
Brandon, set the context for us. Give us a sense of what it is that we need to be concerned about during a pandemic that might affect businesses and how they operate.
Well, a pandemic is a unique scenario in that it is going to affect a large geographic area. The fact that it is a pandemic, meaning it's a global event. That being said, when we look at our economy being a global economic economy, major corporations have interdependencies on vendors that may be in other countries. And even if the pandemic starts overseas, it is going to start to affect us here in the United States. Say, for example, your company has a key supplier that manufactures their goods overseas, and that company may be impacted by what's happening in that other country, and you're no longer able to get those critical manufacturing parts into your supply chain. When we start to have an impact to our workforce, say 30%, is your company able and ready to operate with a scaled down workforce? And then we start to see effects into the small and medium-sized businesses that may only have 100, 200 employees. Well, a 30% reduction in your workforce is a critical impact to your ability to operate your business, for your ability to maintain your relationships with your customers. So we have to start to look at the planning in terms of interdependencies and how we would be able to maintain our business operations as we start to see this domino effect.
And of course, during a pandemic, some people are still going to have to go to work and they're going to have to interface directly with the public in direct customer service. We're here now with Dr. David Bachman, the Director of Occupational Health for this region of the Post Office. Thank you for joining us, Dr. Bachman.
Thank you.
Tell us a little bit about the preparations that the Postal Service has been looking at for pandemic influenza.
Well, the Postal Service is really concerned because we do have in California 85,000 employees who have to go to work every day if we're going to get the mail delivered. And so the Postal Service has put together an emergency preparedness task force to try to identify things that we can do to help if an infection starts or what our response should be to try to prevent it. So we're looking at a couple things. One is education for our employees, and it's like any other viral infection, we need to do the same kind of thing. We need to do We need to do respiratory hygiene. We need to make certain we do regular hand cleansing. We need to do some social distancing. If you have an infection and you're sneezing on me, I don't want to be there.
Absolutely not. We're joined now by Dr. Bob McCabe, an expert in infectious diseases. Welcome, Dr. McCabe.
Glad to be here. The flu bug is spread in what we call respiratory droplets. And these respiratory droplets are produced when we cough, sneeze, or even talk as we are doing now. So the name of the game is to not inhale respiratory droplets from someone who actually has the flu bug. The obvious approach to that problem is to wear a mask if you think you're in contact with someone who is sick, for example, a patient's in the hospital. The trick, however, is that those respiratory droplets may land on a doorknob or on a bedside stand, and you may put your hand on that bedside stand, and we all know what we do with our hands. They go to our mouth, they go to our nose, they even go to our eyes. Sure. So a key point in breaking the transmission of the flu virus from a patient who may even be your coworker, for example, who may not even know he's infected because the flu virus is contagious before you even develop symptoms, is to prevent the virus from reaching your hand, or if it reaches your hands, to kill it. And the way you kill it is by hand washing.
I bet I can tell you there's one thing we're all going to do today, and that is to eat. We heard about work during a pandemic and how to maintain that. Now we're going to hear a little bit from experts about how to maintain our access to food. Important, right?
Actually, it's very easy, simple, and affordable. Some steps you can take to prepare for your family in case of a pandemic. The number one thing to stockpile is water. We recommend that you do a gallon per person per day with a minimum of 5 days. If you can store more, by all means, to store more water. Once you have that down, you can start thinking about some protein items. Canned goods have a really long shelf life, so your canned tuna, your canned ham, chicken, peanut butter's nice, maybe a beef jerky, your family might like that. Then think about some vegetables, canned corn or peas. There's all kinds of canned fruit. Try and pick the kind packed in its own juice, though, not the heavy syrup. And think about dried fruit. That would add some variety to your family's diet. You want to get some whole grains in, but bread doesn't stay long in your garage, so we're recommending maybe a whole wheat cracker, a whole wheat pretzel, something of that nature that would stay on the shelf. And then you can get fancy, kind of add in maybe some sweeteners if you like, sugar in your coffee, and instant coffee if you have to have that. Or think about spices, kind of get creative. Do you want salt and pepper on your foods? Another great thing is the little condiments that you get at a fast food restaurant. Stockpile those. They're small, they add flavor, and they're great to have on hand. What we like to recommend for stockpiling is really stick with the shelf-stable items and then check them about twice a year. So when you do your clocks, go out in your garage, look at what you stored away, and if it's nearing the expiration date, rotate that into your family's meal plan and then restockpile. If you have infants, you're going to want to pack, their formula or some Pedialyte. If it's a senior, hydration's important, so lots of water again, and also a liquid supplement such as Ensure or Boost are great. Diabetics, again, they'll know their special needs and they'll want to pack accordingly. Pack your medicines, and again, make sure you have water to take the medication.
That's great advice.
Think of your pets. Sometimes we tend to forget that. We're focused on ourselves, and luckily pet food is affordable. It comes in cans, it comes in giant, bags.
Grocery stores. We all have to go there. That's where we get our fresh fruits and vegetables and many of our other items. So what kind of concerns might we have when we're dealing at the checkout counter or interacting with people in the aisles? Stay tuned. Find out. We're joined now by Dave Heylen from the California Grocers Association, an industry group that represents over 500 retail grocers. Welcome, Dave. Thanks for coming.
Well, thanks for having me.
Tell us a little bit about how the industry is viewing pandemic influenza and its preparations.
Sure. It has rapidly moved to the top of our concern list as an industry overall. Obviously, everybody has to eat, and our country's food supply is typically considered the safest in the world, and so we're driven to be to follow follow suit with that. And so many retail companies already have contingency plans in place. The food industry has a long history of dealing with natural disasters, man-made disasters. So the core of a contingency plan is in place. It's just tweaking it to this specific disaster. So overall, I would say that the grocery industry is in good shape.
I'm a consumer, and there's probably nobody who's watching this that doesn't go to a grocery store on a regular basis. My concern, particularly with all these doctors running around telling me to avoid contact with other people, is that a grocery store is clearly one of those places where I come into contact with other people. So what do I need to know about walking into a grocery store during pandemic influenza?
The battle plan at this point is to have the individual coming in the store being as best prepared as possible, and that would be the combination of gloves, possibly a mask, having antibacterial dispensers available so that an individual can feel confident when they're in the store. For the industry, it's educating the consumer through meetings like this, and through flyers, brochures, those type of things that a retailer will have in their store to best educate the consumer. Because if the pandemic occurs, the shopping experience will change. There's no doubt about that.
Some of us love going out to eat at restaurants, and we have questions from time to time, even when the pandemic is not occurring, about how clean that restaurant is and what the staff at that restaurant know about minimizing the spread of communicable disease. We're joined now by Don Atkinson-Adams from the county's Environmental Health Department, and they're responsible for inspecting over 5,000 food establishments throughout the county.
We try to look for potential problems because our goal is to prevent illness or prevent problems before they happen. So when we find a problem, we work with the operators to get those corrected. A few years ago, the state passed additional legislation that made it a requirement that there be at least one person in each of these restaurants that has basic food safety training. And that person is then responsible for training other people in the restaurant and for monitoring whether people are actually doing the food handling properly. So we do give food safety training classes to the restaurant operators. When you walk into a restaurant as a customer, or when I walk into a restaurant, I may use the restroom fairly early in the visit, because at that point you can see, is the restroom clean? Does it have soap? Does it have towels? If there isn't any way to adequately wash your hands, then other people who are using it, like the employees, can't wash theirs either. And as we have heard in the previous segments, hand washing is an extremely important way to prevent the spread of disease.
Thank you for coming, Suzan.
Thank you for asking me.
Tell us a little bit about the Alameda County Community Food Bank.
Well, every day the food bank serves people through a network of 300 organizations out in a community. There are arms and legs. And actually people can call the food bank and find out where they can get emergency food from one of our agencies. We'll direct them to someplace out in the community. Our number one customer are children, and then our secondary customer are senior citizens. We serve people who are homeless, people who are unable to get out and to pick up food or to carry food in the community. And we're working very hard to increase our home deliveries to people out in the community as well. And I think that's where it might get interesting in the event of a pandemic.
So in a pandemic, you're going to look at your policies and maybe think about increasing the amount of home delivery and maybe increasing the amount of food you give for people?
Yes, and we also are members of America's Second Harvest, which is a national food bank network. And like in the event of Katrina, what they did is they helped the local food banks in the South acquire more first-run product like bottled water, something I think that we'll all need.
So during a pandemic, we may not want to get on the bus. We may not use our typical modes of transportation because we're concerned about getting close to people. So tell us a little bit about some alternative approaches.
Well, the first thing that comes to mind is obviously walking. If you live near a school, it's easy to walk there. But some trips, are longer. Some trips might be 5, 10, 20 miles, and it's not really fun to walk. that distance, but it is fun to bicycle that distance. So cycling as an alternate form of transportation can be a good choice for a lot of people who are trying to avoid crowded situations, such as maybe sitting on BART or maybe sitting on AC Transit where the guy next to you might be coughing. When you're on a bike, chances are you're probably not going to have someone next to you who's hacking away, and you're also going to be having a lot of fun, as well as increasing your immune system and getting some fresh air, which is always great when there's a sickness going around.
I take the BART a lot. I get on the BART sometimes during rush hour and it's crowded. There are people pressed up right against me. Sometimes people are coughing. Definitely I have to hold on to the hand railing. I'm concerned. During a pandemic, I might be putting myself at risk by getting into public transportation. What are some of the considerations that BART has taken to try to mitigate that risk?
Well, first of all, what we're trying to do is make BART cleaner, and that's regardless of whether there's a pandemic flu. The other thing we're going to do is offer our passengers a way to be able to improve their own hygiene. That'll be anything from perhaps giving out some sort of handy wipes or maybe some waterless stations where you can go and put your hand underneath there and get some gel that'll disinfect your hands before you go through the fare gates or after you go through the fare gates.
BART also has to look at continuity of its operations when some significant portion of its staff may be out sick with pandemic flu. How have you looked at this situation?
We are looking at different plans whereby if a third of the staff goes out sick, what do we do and how do we maintain minimum operations, or if a fifth of the staff. We also are looking at ways of helping people work from home, setting up the IT infrastructure so that way people can log in from home and access their files from home, still get the work done, but not be around as many people in the building at BART and reduce the chance of people getting sick.
Gail, tell us a little bit about what you do.
Well, I'm the quality assurance EMS educator for several fire departments in Alameda County. And in that role, I am responsible for continuing education for these folks, which we do on a monthly basis, as well as quality assurance.
During a pandemic, we're obviously very concerned that the ambulances keep running and that people show up to work and they're able to transport people, because we'd like to make sure that our society, the critical aspects of our society, are maintained. We would have to make decisions about who got vaccine if we had vaccine available. Paramedics and EMTs would be first on the list to get that vaccine. Have those kinds of questions come up when you're talking about pandemic influenza?
Actually, that's been the major concern that these folks have had. Understanding what precautions they need to take was put to rest pretty quickly. But the concern is, will I be in line to get the vaccine? Will I be one of the people getting sick?
The paramedics and their families and the EMTs are considered first responders and would get vaccine as a first priority. They are very critical, and we're so glad that you're working with them to help us help them continue to support us.
That's great. That will be a relief to them too, because they want to get out there and help.
Well, first, let's say this is an ongoing discussion, and it's a preliminary discussion because we're just starting in schools to think about these issues, thanks to you. There are healthy habits. Cough and sneeze into your elbow instead of into your hands. Wash your hands. We have to make sure that the schools have the supplies that they need in terms of soap and towels and tissues. Don't come to school sick. Don't send your child to school sick. And we need to give support to parents so that they understand that and that they don't starve to death in the process. I mean, we need to work on child care solutions as well.
As a school nurse and the school health coordinator for the Oakland Unified School Districts, what kind of things are you working with at the schools to ensure that kids get a sense of what they need to do to minimize the spread of germs?
Good questions, Tony. Actually, in Oakland, we're very fortunate to have just passed a wellness policy, the point of which is to help to improve and maintain the health of our students across the board. And one of those areas that we're looking at improving is health education. Of course, as you know, health education is extremely important in minimizing the risk of the spread of disease. We have to communicate with parents effectively, and it's always important for parents to be involved in their schools and know what's going on with their children's schools. We can send letters home if we have a nurse at the school, and it's always a wonderful advantaged for all students to have a nurse at the school, particularly when it comes to contagious diseases, because the nurse is the first person who can identify early signs.
I mean, does it make a big difference to have that school nurse in the building?
We know from research that students who have school nurses are healthier in general. They are in school more. When they are ill, they're sent home, they get better health education because there's someone there to let them know this is how to wash your hands. There's someone to be checking on vital hygiene measures, such as checking out to make sure that the bathrooms are stocked and supplied, that there's soap, that there's paper towels, to make sure that whatever they're taught about hand washing, they can follow through with and feel that they can be successful in preventing the spread of disease.
Why don't you start off by telling us a bit about the medical therapy program and the population the program serves?
Well, the medical therapy program is part of a larger program called California Children's Services, or CCS is known to many of our families. There are school-based clinics that provide physical and occupational therapy services.
What population, what is the age of the population that you serve?
Birth through age 21, and these are children who have a diagnosis that creates a physical disability.
For instance, if our health officer were to close the public schools where the medical therapy units are located, what would be the plan for delivering those services?
Our staff would, under these emergency conditions, go to where the child is, and that may be in their home with the parents, it might be with a babysitter, they might be staying with relatives during this time. We would give priority to those children who have had recent surgery. We would also prioritize the babies and the children who have been newly diagnosed, and then those who have emergent skills that need reinforcement in order that they don't lose skills in the process.
Well, we're a typical community pharmacy in an area that's blessed with a variety of people from backgrounds from all over the world. The majority of our patients, of course, are older people, more susceptible to disease, and also more susceptible to things like the pandemic flu. We also are concerned that sick and elderly people in particular can't always get to the drugstore. So when that happens, we have a free home delivery service. There's other forms of prescription delivery that work well also, things like mail order pharmacy. Another innovation that's becoming popular in many urban communities especially is the drive-through pharmacy, where you can go to the drive-through window, pick up your prescription if you're ill or concerned about being infected by other people that might be waiting for their prescription, pick it up at the drive-in.
What kind of advice would you give to people about making sure that they have a little bit of extra medicine for emergencies?
Well, a lot of the insurance companies, particularly under the new Medicare Part D plan, limit the patient's days supply to 30 days. And this can be a problem, particularly if you need to set something aside, which I really recommend. I recommend that people keep an extra month's supply on hand.
How is the experience working in these annual flu clinics where you're immunizing 25,000 or so people a year going to help us when we have a pandemic that we have to set up similar kinds of flu clinics?
We manage the flow of many, many people in a very orderly fashion. We've gotten accustomed to working with community volunteers, student nurses, and retired nurses, which would be of great help during a pandemic. We managed to transport the vaccine and maintain the cold chain integrity with the vaccine, which is very important because you want to make sure that the vaccine that's delivered to the patient is viable vaccine. Effective vaccine. And so we manage that very well.
Yeah, most of our patients come from China, and we have a fairly significant population coming from Vietnam, as well as Korea and Cambodia and a lot of the Southeast Asian countries.
What kinds of things might a staff member be asking you as the medical director? What is my risk?
Yeah. Certainly we give them as much information as possible about the transmission and the types of patients who are coming in and what their clinical signs and symptoms might be. We also make sure that there are Kleenex boxes around, because something as simple as covering your cough or giving the patient who's in front of you a tissue will be helpful in decreasing transmission. What we also did was we bought the little Purell alcohol-based rubs, and we put them in each of the exam rooms as well as in all the front desk areas in order for staff to be able to wash their hands very quickly. We help to tighten up our triage protocols so that when patients are coming in, we could identify them right away and be able to engage a special protocol for them to come and avoid the waiting room.
Do you have any kinds of information that you're giving to patients around how they should handle themselves when they come into contact with birds?
Right, we actually do tell them to try to avoid the live birds as much as possible, and if they do come in contact, they need to wash their hands.
Now let's go to Dr. Bob and talk about some of the themes, the recurrent themes that have played out in these 4 shows. Bob, what do you have to say?
Thanks, Tony. The one thing that I think we absolutely need to reinforce is that influenza, be it pandemic or the annual variety, is spread by the respiratory route, and the single most important thing that each and every one of us can do is pay attention to our own personal hygiene. Cover our coughs, wash our hands frequently, and if you're sick, don't go to work because you'll give it to somebody else. Having said that, we need still to prepare on a large-scale basis. This has to do with having adequate supplies for any disaster, including a pandemic, of food, adequate water, medicines. Not only the prescription medicines, we heard about stockpiling prescription medicines, but it's also a good idea to think about the over-the-counter stuff, because these too may well be in short supply. There's another thing that we need to consider, and that's even though we may not have an effective vaccine for a pandemic flu, it's absolutely mandatory to get flu shots and, for adults, pneumovax to protect against pneumococcal pneumonia.
Thanks, Bob. For more information about the science behind pandemic flu or avian influenza, or what governments are doing to plan, visit the Alameda County Public Health Department website. We've enjoyed making this show. We've enjoyed talking to you. We encourage you to call us with your questions, your suggestions, your ideas. Together, we can make this work. Thank you very much.